Let me introduce. I'm Dr. Nur Asni Ibrahim, a representative from Transfusion Medicine Unit, Hospital University Science Malaysia. And I would like to thank to Public Relations of AMSA for inviting me to be a speaker for this podcast session today lah. Okay, in conjunction with World Blood Donor Month, right?
Yes.
Okay.
Okay. So before we continue further, so I would like we already know Doctor here is going to talk a little bit about like blood donation, since we know how the pandemic has hit us and then how it's actually affecting the blood bank. So and also World Blood Donor Day which is first happened on 14 June. So basically this podcast and this session is basically to focus on this. So Doctor, if you may start.
So this session is in order to give the insight to the public regarding the blood donation nowadays. Okay. So this is an outline of my presentation, which including the blood donation and requirement, criteria for blood donation, and also the blood donation deferral, including also the donor recruitment and COVID-19 blood donation during COVID-19, and lastly as a conclusion. Okay. So as introduction, as we all know, the WHO's goal is for all countries to obtain all their blood supplies through voluntary unpaid donors. Okay, and in Malaysia, we are centered that blood procurement is only voluntary, non-remunerated sources. This is from Ministry of Health 2006. And regarding the statistic of the total blood donation and the blood usage in hospital USM from 2016 to 2021, we can see that from 2016 to 2019, it's almost the same regarding the total donation and blood usage. But we have to note that the total blood donation is include the blood that deferred donor, such as serology reactive positive or DCT positive, that we can't use the blood, but it involved in this statistic because we counted as well the total donation, but we expect the blood we can use is lower than this statistic lah. Okay, but then we can see the usage in 2020 having increment in the usage, because we know that after the pandemic COVID-19, the capital hospital, Hospital Kota Baru, have been the COVID hospital. So we our hospital USM have to receive the non-COVID cases, and including all the bleeding cases from in the Kelantan lah. So we have received many patients than previously. That's why the usage of the blood, we can see having the increment starting 2020, and the statistic 2021 till June, we have almost the same from the 2020, and we expect the usage is more compared to previous years. Okay.
Okay. So my question is that since we said that the donation is, we include the people whose blood cannot be used, right? So what if the blood that we can actually use is actually lesser than the demand, is it?
No. I mean that the statistic, the total donation, which mean the how many donors that came and donate. But we have to remember the blood they donate, not all the blood we can use, because we have go to for screening and we have to check for compatibility before we give to the patient. So there are the blood that we can't use because of this serology case positive reactive or DCT positive, direct test positive, which having the problem in terms of compatibility with the patient. So we can't use the blood lah. Okay. Okay. Before I go on further, let's see. Let's watch together the video of pendermaan darah di unit perubatan transfusi di Hospital University Sains Malaysia. Is it okay, Daniel?
Yes, sure.
Okay, thanks for watching. So let's review the who is eligible for blood donation. So the one who fits and healthy in terms of age is between 18 to 17, and for the first time donor is between 18 to 60 years old, and for the 17 years old they have to have permission from the caretakers. So in terms of body weight, we take 48 and above, and for pre-donation the donor has to have a minimum adequate 5 hours sleep and no any medical illness or comorbidities, and the donor have to get adequate meal before the blood donation, and specifically for women, at least if they have menses, they can donate at least after at day 4 of menses and above. And for the pregnant lady, they cannot donate the blood. And for a breastfeed mother, if they breastfeed exclusively 6 months, exclusive breastfeeding, they cannot donate the blood. And including this, the donor cannot have any high risk behavior, including the homosexual, associated with a bisexual or any IVDU or any sexual relationship with the promiscuity or prostitute. Okay, so in general, before the blood donation, pre-donation, we encourage the donor to have having the lot of drink a lot of water, plain water before and after. And after donation, we advise the donor to rest at least 10 minutes after the blood donation. So this all is to minimize the adverse reaction which can happen to the blood donor after the during or after the blood donation. Okay, so this in addition, during the fasting month, the donor, we encourage the donor to donate after 5 hours within the after the sahur time lah. So minimum before the 8 a.m. and they can also donate after iftar, after berbuka puasa. So during the Ramadan, during the fasting month, we are encouraging more to the non-Muslim to donate the blood. Okay. Is there any question, Daniel?
Not for now. So
Not for now.
but to drink a lot of water is to replace the fluid right after like we donating blood.
Yes.
So what if a person does not consume enough like fluid after donating blood?
Okay, we will talk later regarding the adverse reaction that may that the donor may have if they don't follow the rule pre-donation. Okay, continue. Okay, this is a donation frequency, which means a donation interval. Minimum is 2 months or 8 weeks of 56 days, and maximum donation per year for male is about 6 times, which means 2 monthly, and it's good to check the iron store. And for female, maximum is 4 donation, which means 3 monthly. Generally, we take 3 monthly lah per year. So for the apheresis donor, when they want to donate for whole blood, they also have to take a minimum 2 weeks to donate the whole blood from the apheresis, and next time they want to donate the whole blood, minimum interval is 2 weeks. And if let's say the donor donate today and but they can complete the donation, let's say only 200 ml, because maybe they got any reaction, any side effect of the donation. So the red cell loss is more than 100 ml. The next donation is still minimum 2 months or 8 weeks or 56 days. Okay. Okay. Can we proceed with a video for how the blood component is prepared after you donate the blood? Okay, is it okay, Daniel?
Yes.
Okay. Okay, Daniel. Are you is it clear?
Yeah, it's clear, but can you tell us what does the FFP stands for?
Fresh frozen plasma. So, did you clear how the component is prepared? It's actually one pet cell, one bag of the blood can produce the three types of a component. That's why one blood donation can save three life. Okay? That what does it mean?
Oh,
Ah.
no wonder. We always heard like it saved three lives, and we never thought it was actually to be, you know, being selfish as in like the platelet and then also the plasma and also the red blood. I always thought it was just being separated. So it was
Yeah.
really eye opening.
Okay. That's good, eh? Okay, can we proceed? Okay, just now we show the video regarding the blood storage. Okay, so in the video it shows how the blood is stored based on the temperature. Okay, if you can see how the pet cell is stored based on the temperature, it's about 4 cm and platelet is 4 degrees Celsius, or platelet is 22 degrees Celsius, and how long it preserved based on the component and based on the temperature. It's different between the different component. Okay. Okay, next.
So roughly how long does it can stand? For example, how long does the red blood cell and also the fresh plasma can, you know?
Okay, for the red blood cell, it can last for 42 days, but for whole blood for 35 days, and for FFP for 1 year, and it's stored in different temperature in the refrigerator. Okay, for platelet is just only 5 days the lifetime. Okay, and it's stored at 22 degrees Celsius. Okay, and you have to know the platelet is stored differently from the other component because we have to agitate. It's stored in the agitator because we want to avoid the platelet clumping, right? Okay. So, can we proceed, Daniel?
Yes.
Okay. So, when you are donating the blood, who you can help? So you can help this kind of patient, which include the patient who have an accident with massive bleeding, the mother who have an intrapartum or postpartum hemorrhage, premature baby with complicated with pulmonary hemorrhage, and the patient who are going to surgery or transplant, dengue patient, and patient with chronic disease such as chronic kidney disease, and which require the regular hemodialysis, and also burn patient we have a severe loss of fluid and you have to replace with the plasma, and the thalassemia patient which is dependent blood transfusion, 2 weekly blood transfusion, and also cancer patient. So they this kind of patient is regularly transfuse the blood for the survivor. Okay. Okay. Is there any question, Daniel? Before I proceed? Okay. Okay, next, we will discussing regarding the blood donation during COVID-19. So during the COVID-19, we have to be strict in terms of the SOP, and we, as we all know, the blood donation is an essential service, and we by hook or by crook we have to find the donor and maintain the blood pool. in order to save the patient's life. So we provide the donor with facilities that enable them to come and donate easier. Okay, so untuk during the during pandemic COVID-19 ni, to ensure there is a less risk or no risk of COVID-19 to staff and also donor, we have to follow the SOP. For example, anda tidak dibenarkan menerima darah jika baru pulang dari luar negara dalam masa tempoh 14 hari atau mempunyai kontak dengan pesakit COVID-19 dalam masa 14 hari dan mempunyai sebarang simptom seperti demam, batuk, sesama, sakit tekak atau susah bernafas dalam masa 14 hari. So dan untuk for the blood donor as well, we advise them to have a social distance and having the mask and have the hand wash before the donation. And only we allow the blood donor to enter the blood donation center instead of other relatives. And before the blood donation, they have to fill up the borang deklarasi risiko COVID-19 before entering the blood donation center. So for those donor which positive COVID-19, they can donate after 14 days fully recovered from the COVID-19. And untuk memudahkan penderma daripada seluruh tempat untuk datang menderma di musim COVID dan musim PKP lockdown ni, we provide the link slip perjalanan rentas daerah. Okay, dalam link ni we provide in term of masa, tempat dan tarikh bila dia hendak menderma, dan dalam link ni juga terdapat status. Mereka perlu mengisi status kesihatan mereka dari segi sign and symptom of COVID and either having risk or no risk, then only they can come and donate. So another choice of having donor during the COVID-19, we call the donor first and we ask regarding the sign symptom of COVID-19. If they are eligible for donation, then only they come. So this kind of step, it may lower the risk of having the contact with COVID-19 and it potentially boosts up the blood donation drive without compromising social distancing. With having this type of link, and the donor also it's easier for donor to come and donate because they can also choose where the place they want to donate, because we also having the mobile outside the center, outside the blood bank, such as in mall. So those who live nearby the mall, they don't have to come to blood center, but then they can go straight away to the mall which is nearby. Okay. Okay, ni as we all know is norma baharu. We have to maintain the social distancing and also have to wear the mask correctly. And okay. So next, for the donor recruitment objective during the COVID-19, the purpose is to compensate the dropout of donor or deferred donor, and we want to keep the pool expanding. But there are many barriers or factors because the donor recruitment and retention is not an easy task in blood service because the dynamic of the nature of the socio-economic environment and the human factors itself. Okay, so it's very difficult during the pandemic COVID-19 actually. So So what we do is we use the social and media like Facebook, Telegram, and we also call the donor and give a reminder through SMS as well. And we also train the staff to have a good public relationship. And we approach the younger donor like student to be our donor. And we have to promote the privilege of donor. And we also promote the medical health assessment for our blood donor. Okay. So this is our Facebook QR code and Telegram. Okay, you can join me through this Facebook and Telegram. We also update any activities mobile outside the center and through the Facebook and Telegram. So you all you guys can follow us and share with your family members as well. Okay. Okay, in terms of promotion, we have to promote in terms of brochure or poster. Okay, this is one of our initiative approach the young generation. The promotion of blood donation in high school has been attempted in many countries, and this strategy is particularly attractive because successful recruitment of young donors will ensure long-term supplies of blood are maintained. Okay. So, what is the health benefit of blood donation? Okay, one of them is it will reduce the risk of heart attack. It is from the Public Health Malaysia and Pusat Darah Negara information. Okay. So, and the other health benefit is you can replace the blood you have donated with a new one. So, the body will produce the new red cell, which is more efficient to carry your oxygen in the body. So you become more alert, more aware. Okay, during the class. There is effective oxygen in your body, effective red cell, which carrying the oxygen to your brain. Okay. The other health benefit is the donor will have satisfaction. They will feel the more healthy, more focused, more aware, and having the satisfaction in in terms of health, they have a satisfaction. Okay. Previously, did you hear any mythos regarding the blood donation, which can increase increase your body weight? Okay, it's actually the mythos. And do you know that blood donation can burn the calories 650 kilocalorie, which equal to the activity like cycling, senam aerobic, jogging, skipping or swimming. But you have to remember that blood donation cannot be a long-term plan to reduce your weight because you only can donate after 2 months. So what happened previous 2 months too? That's why the blood donation cannot be the long-term plan for reducing the body weight. Okay. So the mythos that say the blood donation can increase the body weight is actually is actually false because the body weight is increase is due to other factor like less of activity, physical activity or diet. diet, and it cannot blame due to blood donation per se. Okay, so this is criteria for blood donation as I explained previously. So I want to just state that the hemoglobin level for male is 13 to 18 and for female is 12 to 18. For blood pressure which eligible for blood donation is systolic must ranging from 100 to 150, diastolic from 70 to 100. Okay? Okay, the other information is like I explained previously. Okay, donor criteria is another donor criteria that the donor cannot is not eligible to be a donor is when they have a high risk behavior like if person with high risk of being infected with TTI. TTI stand for transfusion transmitted infection. Okay, and they must be permanently deferred from future donation, and their sexual partner must not accepted as well as blood donors, and the high risk transfusion transmitted infection in homosexual and bisexual, and having sex with sex worker or prostitute, and frequent changing of partner, having a history of intravenous drug abuser, and even the partner of above criteria as well also they cannot donate the blood. So it's important during counselling we have to really emphasize regarding the risk of such behavior because it will contribute to serology positive cases. And lastly, the blood that have been donated cannot be used, and we have to further investigate the donor. Okay, let's continue. What is actually the TTI? TTI is stand for transfusion transmitted infection, which are infections resulting from the introduction of a pathogen into a person through blood transfusion, and it's a wide variety of organisms which including the bacteria, viruses, prion and parasites that can be transmitted through blood transfusion. Okay, so the objective of blood donation to have a safe blood, to provide adequate, safe and high quality of blood and blood product at any time to the patient. Okay, so right blood is given to the right patient in the right place and the right time. Okay, so to ensure that we are having the minimal risk of infection of TTI, WHO recommended that it is mandatory for the provision of a safe blood supply to screen all of whole blood and apheresis donation, screen for infection that are transmissible by transfusion as follow. We are screened for HIV, hepatitis B, hepatitis C and syphilis. Okay, so each blood that we have donated, we are screened all this kind of for TTI. We screen for TTI. Okay, so we go for the adverse donor's reaction. What can donor may have during the blood donation? So as simplified, it consists of the complication with local symptom or generalized vasovagal reaction. Okay, so for the local symptoms, it consists of the complication which characterized by blood outside the vessel, complication which characterized by pain or localized infection or inflammation of major blood vessel injury during the bleeding procedure. And for generalized reaction, including the vasovagal, the donor may have a loss of consciousness, pre-syncopal attack or syncopal attack, vasovagal reaction with complication, or vasovagal reaction with injury or non-injury. So, there are many other serious complications, which including AMI, acute myocardial infarction, cardiac arrest, transient ischemic attack, CVA, cerebrovascular accident, or even death. And in terms of the specific apheresis reaction with citrate reaction, hemolysis, air embolism, or infiltration. And for the allergy, the donor may have a localized allergy reaction or generalized anaphylactic reaction. However, they are rare in terms of serious complication, but we have to monitor closely during, during, or and after the donation. And it's very important, we have to advise the donor and counseling the donor regarding this kind of problem. Okay. So the safe blood donation is coming from the safe counseling, and also during the blood donation, we have to monitor the donor closely during and post donation. Okay, and we have to careful during the counseling. It consists of BP checkup and also pulse rate. And then that's why they have a criteria for who eligible for to be a blood donor with the normal blood pressure 70 to 100, 70 to 100 for diastolic, and for systolic from 100 to 150. Okay, so this is a common adverse reaction for donor. Is vasovagal reaction. Okay, the donor may have a sudden fainting, neuropsychology response such as apprehension, first time donor, female, having emotional stress or sight of blood. So there's a prevention, as I said before, during the donor screening, and having a psychology support to the positive donor, and having the relationship and reassurance, and also physical comfort like temperature and surrounding environment also give positive impact for the outcome of the donor. So how to minimize the donor reaction? Donor education before and after donation, which is during counseling, yeah, and volume of blood drawn, which is 8 ml per kilo of the donor body weight, and distraction strategies such as audio visual entertainment, and having the hydration, drink a plain water at least 30 minutes before donation, and having applied muscle tension, repeated rhythmic contraction of muscle of arm and legs that can minimize the donor reaction. Okay, so as a conclusion, blood should be procured only from voluntary non-remunerated blood donors, and to keep the pool of the blood stock maintained, we have to create the public awareness on blood donation is crucial in order to recruit the new donors and maintain the blood supply. And giving a pleasant donor experience and overcoming adverse event will enhance the probability of becoming a regular donor in the future. Okay. So last but not least, darah tak pernah cuti, and hope I think that's all for me. Uh,
Okay.
Information from our FB or Telegram website, and you can also can having share the link for the Sleep Pandarma Darah to your family member or friends, and come to join us to donate blood and support our blood donation team. Okay, so you don't have to be a doctor to save a patient. Just be a donor, give blood and save life.
Yes, I totally agree with that. And um, actually, I have one question. When you talk about how after 14 days, a person with maybe they have infected or they have close contact. But my question here is that if a patient, not a patient, if someone came in, they just vaccinated. So how long is the period after vaccination can a person donate blood?
Okay, after the vaccination, the donor can donate after 7 days of vaccination. But if they have the symptoms, you have to add another 7 days after the last symptom. Such as if they have some symptom of fever, rashes, or dizziness, or any symptom develop you after the vaccination, and you have to add another 7 days after the symptom, then only you can donate. Okay?
I think the biggest thing that I was curious, and I think a lot of people was curious, is that since the pandemic hit, there's like a shortage amount of people not donating blood. So there's shortage. So what if happened like in certain situation, very emergency situation where there's like shortage of blood in certain hospitals? So what is like the process? They get like transported blood from other hospital, or how?
Yeah, for sure. We are having get a help from the other nearby hospital, like Hospital Kota Baru, Hospital Sultanah Nozahira Terengganu, and Hospital Sultanah Hospital Oshas Temerloh, Sultan Haji Ahmad Shah Temerloh. And we are not frequently, but have once or more previously having their help to maintain the blood stock in order to help our patient.
I see. And I see actually University Science Malaysia, our university itself, is doing a lot of effort. Like they came to our cafe to ask for blood donation. And it's very crucial because, you know, we are among the age that is eligible for donation. So it is a good work. And I totally agree with Doctor when you said that the one of the benefits is for the people to, you know, somehow they feel good after donating, such as like kepuasan diri. Because my mom, when she first donated blood, she couldn't stop talking about it for a day. She would just keep talking how she donated blood. She would keep telling us how it felt because we haven't donated blood before that. So she would tell us how it felt. Yeah.
Okay.
It was amazing.
Okay. Good to hear that, Daniel. Okay.
So since we are facing this pandemic and also blood donation, so Doctor, do you have any last word to say to the you know, the listener, the audience, like encourage them maybe?
Yeah. I really appreciate those who are being the donor, and I encourage those who never donate yet. Be my hero. Be our hero, and came to donate blood, and help us together to help the patient. Okay, I hope all of you can promote to the relative and friends, and sharing our website. Join us through website, FB and Telegram. Like and share, because we always update the information through that kind social media, like we do nowadays. And if you all guys having difficulty, you are you are invited to call and ask us anytime through the link that we are provided. Okay?
Okay. So I want to thank Doctor so much for agreeing to do this, and I want to stress on how important it is to donate blood during this tough time, and also don't forget that we're still fighting this pandemic. So stay safe, everyone, and again, don't forget to donate blood. Don't always donate blood if you can. You're eligible, and if you are,
Okay.
with the criteria. And so everyone, thank you once again, Doctor, for agreeing to meet with us.
Okay.
Thank you so much.
Okay. Thank you to Daniel and also Public Relation, AMSA, USMKK as well for inviting us and having the chance to give the talk and also the promotion. Hopefully, this kind of thing will we keep the blood donate. We will give the insight to the public regarding the blood donation, especially during the pandemic COVID-19. Okay, thank you so much, Daniel.
Okay.
Okay, thank you.
And don't forget to follow. And I will provide the QR code to follow, and add to follow the Facebook and also Telegram, so that you can get more information on the blood donation in CSS Malaysia. Thank you so much, everyone.